she was deadlifting apparently.
Maybe like a couple weeks ago. In the morning. And my coach didn't exactly show me how to do it, so I kind of just
Winged it
like everybody else.
First question is, when did you get diagnosed with scoliosis?
I guess I've always known I've had it.
I mean, since she was probably, I'd have to say probably about 8.
Someone got this on an x-ray to diagnose scoliosis.
Correct, I believe so.
Yeah.
Long term, with scoliosis, you don't want to adjust away, from like a proper curvature, because today's not going to make a difference. We're just going to be focused on helping your back be better, and we'll talk all about that. But in the long term, if a chiropractor adjusts you or someone pushes on your back or you're stretching, even in the wrong direction, that induces more rotation. It can make the scoliosis quote unquote worse. What it's really doing is your neurology pushing your body further into what we would call subluxation or injury. So it's really important to get the films moving forward.
So that way you know what you're working with in a sense, right?
Yeah, absolutely. Okay. Over deadlifting and then you got hurt, or?
No, this was like the second time we did it, and then it was maybe like 2 weeks ago, and then my back didn't start hurting until like maybe a couple days after. And it was just like a little sore, and then it just progressively got worse.
Okay.
And then she also said that the pain started coming out.
Yeah, it started coming down to like my tailbone, down to my leg, like just this leg down.
When you stand up from sitting down, are you sore or it hurts or it takes you a minute to stand upright?
Yes.
How many repetitions were you doing? Like 10, 12, 15 repetitions in a given set?
It was 3 sets of 7.
A lot of people will deadlift. In my opinion, is no reason for someone that age to be deadlifting, but especially with like a lot of sets. And then, yeah, if your form's even a little bit off, even if it's not a little bit off, to be honest with you, it's easy to get
Even if it's too much weight or...
Yeah.
Point to where it hurts.
Like right here.
Okay, let that leg go down. Chin come down like this. Does that hurt your back too?
Yes.
Okay, on the left side only?
Yes.
Right leg forward. It would be funny if you kicked the dog. Does that hurt the left side as well or not?
Yes, it
okay,
does.
both. All right, and let it go. All right, I'm gonna lift up the back of your shirt. Bilateral sacroiliac joint. Usually there's swelling if a disc is like really.
Let him know if it hurts too, so that way he knows he's...
Wait, hey, don't say anything yet, Nicole, but does that hurt right there?
Yeah, a little bit.
Is this sort of like the spot where you get pain?
Yeah.
Yeah, you can feel it. And then this one, what do you think? Like, no or yes?
Not
No? Okay. See, this is like compensated because she's like walking probably crooked a little bit, and that's tight. That's pretty bad.
Oh yeah, that hurts.
All right. Go ahead and touch your toes, kind of, sort of, and come on up. You can see the scoliosis.
Yeah, you can see it.
So that means that this is the left side peak is here, so right side is peak is here, and the rotation is like, see if this is left, so this is right, so we want to set this way. Okay. Biomechanical rules, you forget about them after years. Hello. How many brothers and sisters do you have?
Only one brother and 3 sisters.
Oh. My.
Who's your favorite?
She probably answered. Look, he's looking at you. He wants you to pet him.
It's really, we're testing to see if your spinal column is what we call tethering, when your chin is down and your leg comes up, which it did, right? So that induced more pain or exacerbated pain. And we don't want that to happen. And the reason it's happening is because you overstretched, aka like hyperstretched your bottom of the spine. And so the disc is irritated. I'm gonna do something that's gonna take the pressure off and make the spine be like, oh, it's not so irritated. Worst case scenario will be underwhelming. Best case scenario, it'll feel really good.
Do you want her heels on the pads?
No, not yet.
Okay.
You're fine. All right, bring this leg up like this. This is the leg that hurts, yes? Mm-hmm. Okay. So we're shortening the leg that hurts. Hug yourself like you love yourself. Follow my breathing instructions. Take a big breath in. And all the way out. Tuck your chin down a little bit. Yeah.
Oh my gosh.
That was easy, right?
Mm-hmm.
Felt good? Good. It's probably, an important component. I say it because I don't want to get everyone false hope, but there's one time I adjusted someone's big toe and their back pain went away.
Wow.
So, 1 in 500 there, so, maybe it'll be 2. You're normal. Any pain with that?
Mm-mm.
Good.
Oh my god. I didn't even know you could pop that.
This one will be lighter on purpose. Look up with your eyes. All right, good. And relax and breathe. Good. All right, so here's what we're gonna do, Nicole. You're gonna come up, walk around for 2 seconds, and then we're gonna do a side posture adjustment. Relax more. Perfect. Too easy, right?
Yeah.
Did you feel it right on the spot?
Yeah, I did.
Come on up. Walk around.
Mm-hmm.
Tell us what's different.
Probably gonna take a little bit too for like everything to relieve, but I'm sure.
Just say if there's anything that you felt when you were just at like a baseline that's different, and if there's nothing, then I won't be offended.
It kind of hurts a little bit less when I walk, cause when I would walk, it kind of felt like very tense. Like I kind of had to slouch over a little bit, and I don't know. I kind of feel more straight.
Okay. Bring this arm up and over, and just relax everything. Look for the dog and let your hip fall over. Good. Perfect. Come on up.
Not too bad, right?
No.
She's like, that woman, I was scared about that.
I know, I was scared a little bit.
She's like, oh, I want to come over there again. You comfortable?
Mhm.
If you want to move up, actually scoot forward a little bit, your face will be even more comfortable. Was that right?
Mhm.
Okay, good. Relax your body. You do any foam rolling? Do they do foam rolling? Nicole, do you foam roll? You should foam roll a little bit, like on the outside here. Like if you lay on a foam roller and through here, that will help. It'll hurt a little bit, but it'll help. All right. Let your hands fall down to the floor. I won't step on you, I promise. So you'll feel this here on purpose. I just want to make sure that all the, look up, look ahead. There we go, that's it. All right, any questions, comments, concerns?
Are you able to march in place? And does it feel different?
Yeah, it doesn't hurt.
There you go.
Wow.
Mm-hmm.
Okay. Thank you.
Mm-hmm.